This module will focus on the human factors that need to be considered prior to initiation of adaptive cycling. Prior to even considering and trialing adaptive cycling program, you should evaluate the individual's motivation and goals for cycling to determine if recreation, competition, off-road, or therapeutic motivations are their goals. You need to assess for presence of disability, types of medical comorbidities, and the current versus goal activity and fitness level. Of course, we're most concerned about safety, so medical and safety screening should be completed prior to initiation of cycling program. Medical clearance from a physician or other provider should be considered prior to an actual trial. Some considerations for this are that the physical condition is appropriate for cycling and that an interprofessional team involved in the trial selection, training, and fitting are involved throughout the process and are qualified to assist. And at all times, a helmet should be used when someone's using a cycle of any type. Some other considerations prior to a trial. These can typically be assessed in an interview and initial evaluation. For transfers, we'd like to know how that individual typically transfers. Are they able to transfer to a lower surface with or without assistance, as most cycles are a bit lower than a typical chair? They're able to place their lower limbs on the cycle with or without assistance, and other considerations of just simply getting into the device. Other considerations are medical comorbidities and level of fitness and condition. An individual who is not in physical condition to start an exercise program may benefit from more traditional stationary training in a gym or other setting like strength training and cardiovascular training prior to considering adaptive cycling to ensure safety and capacity to participate. As mentioned in a prior module, individuals with low vision may benefit from tandem cycling, but for individuals considering a hand cycle or a recumbent cycle, not a tandem cycle, the vision assessment should be part of the evaluation to ensure safety. Particularly in relation to considerations of transporting the cycle and transfers, falls should be assessed. Because it is, again, mentioned, potentially a more difficult transfer than someone may be accustomed to doing, and because moving the device in and out of a vehicle or on and off of a trailer, for example, may require additional considerations for balance and could lead to additional falls, particularly in someone who may be experiencing falls already. Cognition is also a consideration and should be assessed in the evaluation. And if a care partner or training partner is going to be involved, they should be considered throughout the process and potentially be involved if possible, particularly if the individual using the adaptive cycle is likely to require assistance to use the device safely. Physical condition should be assessed in the initial assessment and evaluation process. Again, the condition requiring adaptive cycle versus traditional cycle, so the type of disability or limitation. Some of these are a bit more clear what type of cycle is appropriate. For example, someone with paralysis of the lower extremities is not going to use a recumbent cycle. They'll use a hand cycle to accommodate the disability of their lower limbs. For individuals who have maybe less clear types of disability with back or hip range of motion limitations from arthritis, for example, using a recumbent cycle versus using a traditional cycle with some accommodations may be less clear, but exploring all of these physical conditions can help in decision making. Range of motion of the full body is important to note so that you can accommodate or help with decision making of what types of cycles and accessories are going to be appropriate for that individual. Strength, of course, to understand how the person's going to use the cycle, potentially in what way the cycle should be set up so that they can utilize their strength to their advantage, and not put them in a position where their lack of strength or decreased strength is going to set them up for difficulty with using a cycle. Balance and trunk control should be considered, again, for safety and in the type of cycle. If someone has limited trunk control, they may prefer a more reclined position to take advantage of the stability of the cycle. Sensation and sensory perception should be considered to note how someone may need to be more prepared and protected to protect their skin while they're cycling, and for someone who may have limited sensation or limited joint protection to note that they may need to be set up so that they are not in positions where their joints can be damaged and they wouldn't feel it or be able to control it. And cardiovascular function, because this is a exercise activity, considering someone's current state of cardiovascular function, what their goals are, and how closely those two are to each other, or are they lofty goals that, again, someone may need to train prior to using an adaptive cycle. And safety should be assessed for all of these throughout. When actually trialing a device and considering is it safe and is it set up correctly for the individual that's going to be using it, some key points to consider are range of motion. For a hand cycle, ideally, you would have near full elbow range of motion, although it does not have to be active elbow range of motion. A full stroke on the hand cycle should involve a large arc of elbow flexion and extension, and then should be a slight flex in the elbows at the furthest point of the arc. Shoulder position typically stays below 90 degrees, but does vary depending on position and type of hand cycle. With different accessories, many range of motion limitations of the wrist and hands can be accommodated. For recumbent cycles, similar to upright bicycles, a large arc of knee flexion and extension is used, with a slight flexion of the knee at the farthest point of the arc. Hip position can be adjusted to accommodate hip and spine restrictions and range of motion and strength, but the motion limitations at the ankle may be accommodated with specific considerations and setup or with additional accessories like straps if needed. When setting someone up in a trial device, additionally, we're going to consider skin protection, protect areas of high risk where they're weight bearing through bony areas, and consider what areas are tolerant or not tolerant of pressure, and preventing shear. Again, this is something to consider, particularly in the transfer, because this may be a more complicated or difficult transfer for many people. And safety prior to actually taking off, it should ensure that the individual understands steering, shifting, and braking prior to actually moving the device or going into an environment indoors or outdoors where they can use the device. The trials should be supervised, and during cycling, things to assess and monitor are similar to any exercise program, monitoring for activity tolerance, and taking notes of any concerns that require cycle adjustment to complete this trial or for another trial. These could include pain, efforts and levels of exertion, balance and control, skin safety, and any adverse responses. After cycling, you should also assess and monitor fatigue, the ability to transfer after fatigued. And again, most people are going to transfer up from a lower surface, so that may be more difficult, and then more difficult still after they're fatigued from doing the activity. That is something to consider and potentially assess need for increased assistance. Assess pain, cardiovascular, training activity, and tolerance, as well as skin should be checked in particularly areas that are not pressure tolerant. The next module is additional considerations for adaptive cycling.